we have families who have needs that change from time to time. All of a sudden, the program that was working for them isn't going to work for them anymore because we want them to be learning about language nutrition. And they're like, but I can't pay the rent. I can't feed my children.
When developing language promoting interventions for parents and caregivers, how much do we really consider the reality of their daily lives and the challenges they face? In this video, Drs Stapel-Wax and Susan Brasher describe their Talk With Me Baby Connects program and how they've learned that our parenting intervention must align with the real-life contexts of families. Many families are struggling just to get through the day, and talking more with their baby might not be their top priority. Jennifer and Susan highlight the various factors that can influence how parents interact with their baby on any given day. As you watch their video, notice how they talk about listening to families to understand what they need so they can foster their children's development. They are implementing Principle 3, co-creating intervention. This means they develop language promoting strategies in collaboration with families and community agencies, ensuring that interventions meet the unique needs of each family. They are using an equity lens to create interventions that will work for each individual family. I'm so glad, Jennifer and Susan, that you're able to join me today. Why don't we begin by telling our audience who you are and what your affiliation is?
I'm Jennifer Stapel-Wax. I'm a professor in the Department of Pediatrics at Emory University School of Medicine. I'm also the director of Infant Toddler Community Outreach Research at the Marcus Autism Center at Children's Healthcare of Atlanta.
I'm Susan Brasher. I'm an assistant professor at Emory University School of Nursing.
Why don't we begin by first talking about the language promotion work that you're doing in Atlanta and what's so unique about it?
We're working on a project that is entitled Talk With Me Baby Connects. And our approach brings together Talk With Me Baby, which is a philosophical, programmatic approach to language nutrition that we've been doing for over a decade. And so our approach has been to take the concepts of Talk With Me Baby, to ask the questions to families about what they know and what they want to know and what they most need, and try to bring those together so that the parents, the children, the family is getting what they most need, and we're able to introduce these ideas about early brain development early enough for success for those young children.
It really strikes me as very equity focused. Maybe you can talk about how you've really taken on some of the principles in this paper to focus on equity in your work.
What I can say in terms of our project is that it really comes down to the community and the connections that we're forming within that community. And so Talk With Me Baby Connects is advancing equity by addressing the multiple factors that influence the well-being and at the various levels of the person, the individual, the interpersonal, the community, and how all of that contributes to disparities and inequities.
One of the things that we've learned in some of our past home visiting is that the families that sometimes need our intervention the most are the ones that are most likely to drop out of our programs. And some of it is because we haven't really thought about what the families are needing first.
Right.
So can you talk about that a little bit and how you incorporated that into your model?
You know, I think we're faced with both sides of the coin here. We'd like to do something that has a model-based framework to it that has been suggested that if you do, this program across 8 weeks or 8 months, then this is how it's going to work. And yet we have families who have needs that change from time to time. Did you say anything else, Susan?
Yeah, I think, Judy, what you said is perfect, is that there are families that could really benefit from certain programs or certain interventions, and yet those are the families that are often not at the table. A perfect program isn't going to work perfectly unless you listen to the families to find out what is it that they want and they need, and that they can have a say. And not only the families, but the stakeholders, the community organizations that serve those families, to really say, we've tried this before, it didn't work, or maybe if we did it this way. And so really listening to them, partnering with them as true partners, and hearing from them of what is it that they want and how things can be modified, and what are those determinant factors that's going to lead to successful implementation, is really a critical, I think, ingredient to our work, and that we really value their input, but also their participation in driving it forward to ensure its success.
It seems like you co-create not only at the community level, but you co-create with the individual families as well.
Yeah, Talk With Me Baby Connects is really about the more individual sort of parent-child interaction of Talk With Me Baby. And then the Connects portion is really about that co-creation of what will we be doing in collaboration with the supportive community agencies that family is in connection with, in the community in which they live, in the context of what's already available to them or might be available to them. And so we do have our eyes looking in both directions, at, the strengths of what the family brings to the table, and how they will take on Talk With Me Baby, and language promotion, but also what are the strengths and abilities and things that are already being done in the community, because we're also looking for sustainability.
Sure.
And so we want there to be an ownership of these initiatives.